In this episode,
I'm very excited. That's why I'm so excited. And I wish I was that student. I wish you were there 20 years earlier. The great thing about social media is that anyone can be there. And then, of course, anyone can say anything. But again, you can also put things in a way that makes sense to this population or this population. And you can tailor that. So condition into context. I think that's where our unique skill set is, because we know how the body works.
Daily dose of honest science.
Hi guys, and welcome back to Daily Dose of Honest Science, your science show that covers medical science. And I'm your host, Dr. Chandni Kumar. I'm a bit sorry, it took a bit longer than over a month that I had a new podcast episode, but today is very, very special for me. So in today's episode, we will talk with a lovely guest about the life of being a medical professional and how this has changed over the time and the years, and how actually content creation has become part of her daily life, and how she manages actually the stress that comes with it. Moreover, we will also talk about how important it is to talk about and communicate proper medical and scientific advices to her patients, but also to her audience. In addition, we will dive deep into how science and medicine drifted apart actually, and how we can get both disciplines back together. So today I have a really wonderful guest. So she is an experienced doctor living in Hong Kong. So that's why you see her here as a Zoom meeting. It's really, really cool that she has time. And she's a board-certified healthcare professional in Integrative and Functional Medicine from the American Association of Anti-Aging Medicine. She's working in the health, wellness, and fitness industry. Additional qualifications are in holistic health, lifestyle medicine, and healthy longevity, even menopause and nutrition. She's a public speaking figure and member of the Healthy Longevity Medicine Society, Australasian Society of Lifestyle Medicine, and International Menopause Society. She studied medicine at the University of Newcastle, and her working experience, and that's just a short overview. She started her career as an integrative physician, then becoming, of course, a medical doctor. And then over the course of her journey, she was also a consultant and a part-time lecturer at the University of Hong Kong. And currently, she is a medical director at the Choice Health Limited. So please give a warm welcome, a big applause to Dr. Laurena Law. Hi, Laurena.
Thank you. Hello. Thank you so much for having me. I'm so excited to be on this podcast.
Oh, me too. I'm really excited to talk to you. And it's the first time that I have a medical professional on my podcast. And since day one, I wanted to have someone from this medical field so we can talk about the really cool topics that I wanted to cover with you. And I think we should dive directly, right?
Yes, let's do that.
Okay, so I've split it in 4 parts, our conversation, and you might hear sometimes some noises, which are the lovely dogs of Laurena. So sometimes you could hear some barks also. I think we start right away. I call this section Becoming a Doctor and how it changed over the course of the years. Laurena, you have been working nearly over 20 years now as a doctor, and I would like to know why actually you become a doctor, and what was your motivation to become one?
So thank you so much for this question. Actually, I grew up in a medical family. So my grandfather was an army surgeon and working in China. And he had passed away very young. That was on my father's side. And that inspired my dad to also become a doctor. And so both my parents are actually medical doctors. And so I was very inspired because even for my mom at that time, women were not really part of the medical field. There were very few women who were actually doctors. So both my parents actually took care of people. They worked in hospitals, in private practice as well. And so I would be surrounded by medical books. So lots of pictures, lots of sometimes scary pictures, but I think I probably grew up with this being around all the time. So it wasn't really freaking me out. So I would go through these books and I would ask my dad. I remember asking my dad, what's wrong with these people? Why are they why do they look so unusual? What's wrong with them? And he would explain very patiently what was wrong with them and would tell me that this is the type of conditions that they had to see and that's what they would do at work. So I thought, wow, that's such a great way to help society and help people while making a living. So throughout my studies, I was always curious about the human body and how it worked and how one day perhaps I could also be talented enough to get into medical school and do the same thing. So I guess that's kind of the journey, and the reason why I wanted to become a doctor was really to help people and to relieve suffering and to make life better for others.
Would you like to share maybe one key moment where you said that's the direction I want to go, maybe because you said it was a bit scary. I guess you mean the anatomy books, or in general just cases that your parents were discussing, how to treat certain patients, and just sharing with, that was the dog, sharing
Yes,
with the audience maybe. He also wanted to say something, right? What was the key moment where you would say, yeah, that shaped me or my path?
I think it's really hard for me actually, because I guess I was always surrounded by this normal conversation about different types of, not that my parents talked about work all the time. In fact, they tried not to talk too much about work while we were as a family. But I actually remember going into hospital after school because that was when my parents had time to, that was when I was dropped off at school. So that gave a chance for me to actually be in a hospital. And I remember actually playing in one of the rooms that doctors have for rest and recovery. And I remember that there were nurses there as well. And they would come in and they would be having their tea or coffee and they would go, oh, who's this? And they were always really super friendly about children of who would come and visit. And I really got to see how everybody was just so excited about being there. And I thought, this is the kind of environment I want to be. I want to be a part of this team that worked together. And it was just great that there was a whole group of people who was there to help others. And I truly wanted to be a part of that because I felt how great would it be to work with other human beings and to really learn from each other. So that's really what I remember from my childhood memory. And that's the kind of environment that I just love to be a part of. So it wasn't so much any condition, but it was really just the type of people in the environment.
Thanks a lot for this very amazing insight. So maybe we go to the next question, because being a doctor means, of course, a lot of study and many exams and sometimes hours in the clinic, I guess, that really exhausts you, right? But what were the biggest difference or changes in your profession that you have noticed now over the decades that you are working, also including the pandemic?
I think I see changes on both sides. I see how the pandemic had really put a lot of pressure. It was a pressure test on professionals, particularly those who are in the front line. I'm in private practice, so I didn't really have a chance to be in the emergency department or the hospitals, but I do see from knowing other colleagues who work there that there was a lot of pressure, and you would read about it in the news. And having spent a lot of time in the hospital in my early days of training, I can see how that pressure can really get to people. And I think that's maybe also some of the reasons why there is a bit of a decision amongst some colleagues to either retire early or maybe work part-time, because that immense pressure built up had created a lot of personal stress as well. Because when you're in the medical profession, there's always a constant struggle between balancing your own health priorities and your family and the needs of the people at work, your colleagues, and your patients as well. So I think that's something which maybe a lot of people were not aware of prior to the pandemic. And now it's been uncovered. And I think we're seeing the consequences of some of this happening. So I think that's important aspect to address and realize. And it's also really important for me because when I tutor at Hong Kong University, it's a group of medical students who are in their first year and their final year. And we talk a lot about medical ethics and how do we balance that with our own needs for rest, recovery, burnout prevention. So it really is a constant priority. You almost have to be intentional about that and build that into your own self-care. Mm-hmm. And sometimes I think we struggle because we think it's selfish to take care of ourselves. But I think it's important that we do take care of ourselves because we are looking after other people as well, and they rely on us.
Yes, I often hear how challenging it is for some people working night shifts all the time, and it's from some not colleagues, but medical professionals that I'm close to. They also say how difficult it is sometimes for them even staying on the healthy side, because they have this very messed up, I would say, a working schedule. And in my opinion, a doctor cannot be on 100% like 24 hours, right? 7 days a week. Mm-hmm. It's not possible. And I think there has to be a change also in the way we treat our medical professionals, right? Mm-hmm. And in your case, you're not, I guess, not working in the clinic in that sense. Mm-hmm. So, and you also changed a bit your perspective, because you did not go the classical way now, become a doctor and specialized in a work and or in a field, and now work in a hospital, because you're more on the preventive medicine side. As I said, you go more on the health, wellness, and longevity as a specialization. So, why did you go this way? What made you the urge to say, I want to specialize in that? And what do you think are the benefits?
So when I actually was in medical school, we were quite fortunate that we started clinical rotations even from the first year. So we were exposed to patients in hospital, in practice, in clinical care. We were able to interact with health professionals, which is really fantastic and great. And I started to see a pattern. And the pattern was that a lot of these conditions actually had a lifestyle component to it. And so I was very curious. And so in my final years, I got to work and do placements in rural healthcare. So there would be one family doctor, and he would look after most of the town, but he would also go to the hospital and he would do some minor operations, because he was really the only doctor in the area in Australia. Wow. So as you can imagine, such a big country with lots of and you know, not enough healthcare providers, and so he was really the only doctor there. So I got to see how he was managing. There were other doctors, so they would take shifts in going to the hospital, but he would then come back to his clinic, and then he would see patients that were working on the farm or his neighbors. And I got to see a lot of really interesting cases. But at the same time, I think there was also this growing awareness of obesity, overweight issues, metabolic syndrome, heart disease, diabetes. So I think like even during the end of my training, I realized that this is an area I'm very curious about because firstly, I didn't actually get much nutrition education. And this is probably very common and
Yes.
people may not realize this, but actually doctors don't really get much nutrition education. We don't really get much of information about exercise physiology. Yes, we understand the basic sciences and physiology, so we do have the potential to learn and further study if we choose to. But there was no clear path at the time for me to go and say, look, I would like to learn about preventive care, because when you look up the definition of preventive care, it actually talks about vaccinations and screening, but that's disease looking. It's looking for early detection in disease. It's what I wanted to do was even earlier than that. How do we get people to actually live healthier lives? How to adopt healthier habits? And so in my search, I found different colleges and different courses. So it was very very personally curated. And I wanted to do this because I thought, well, there is a growing burden of chronic disease and it is becoming an economical issue. So how do I address it from the root cause? How do I help contribute to that and be a part of that? Because that's what I'm excited about, is actually preventing people from suffering rather than waiting until they suffer. And sure, we have great technology and it's just as important, but I want it to be sort of even further earlier to be a part of that movement. And so that's kind of where my thinking was even from a very early stage. I wanted to be a part of that. But as you know, there isn't any particular pathway. So over the last 20 years, I've set up my own clinic, and at the same time, I've searched for credible courses, tried to learn from institutions that are targeting doctors and trying to educate them about nutritional medicine, about exercise medicine. So I guess that's kind of how I've built myself my own path and my own career, because it wasn't something I could do in the hospital. I really tried. I tried to look for a discipline in the hospital system where I could really practice in that way, and I didn't. So I kind of had to create that myself. Yeah.
Really amazing that you started your own journey, and we can see you're successful, you're a speaker, right? You're educating your fellows. What is kind of interesting for me is I think in the hospital setting you anyway cannot really do preventive care in that sense, because the people are already at the disease state, so it has to start already much earlier, as you said. And what is really striking for me is, and I never had that before, that medical professionals do not really have so much education in nutritional science and in exercise science, which actually makes so much more sense that they have it. And as I told you that I just made an event actually just 2 weeks ago where we were talking exactly about this problem, and it was really amazing. And people who are listening and also watching, we are trying to get a final cut. It was unfortunately in German, but the takeaway message was it's not only about that we change the system itself, it's also about educating our medical professionals about this, to make more room also in the educational system, because I'm fortunate enough and really honored that I can do some basic science, teaching it to medical people, students, and there they always complain, like, why do I have to learn the pathways, and why is preventive care so important? And then I try to tell them how important it is to already help people in the very beginning, so you can actually delay or even prevent certain diseases, right?
And I also want to
yes.
add that even if you have a disease, it's never too late
Yes.
to make those changes. And they can actually really complement each other. So, so I'm very excited. That's why I'm so excited. And I wish I was that student. I wish you were there 20 years earlier.
Well, the problem is it's not a medical fellow telling them, it's a scientific someone who's telling them, and that's why I love this interface between both of us, because in the end we both want to understand the human body a bit more, and want to provide to understand what is happening in the disease state rather than in the health state, what is different to treat it. But I noticed a lot of changes in the medical field. And what would your take be to promote more preventive health care? And so in the last time when we talked, we had a lovely conversation also on Zoom, where you talked about it's changing. The overall medical field is changing towards more preventive care. And maybe you can elaborate a bit more on this, and what, in your opinion, has to change that these things are more implemented and are more in the head of every medical professional. Because I think Dr. Mike is already doing a really great job in doing that and educating people, but I guess it should reach every medical professional out there.
Yeah, so I think it's also because we're having more data on what type of lifestyle and what type of different eating patterns or exercise is helping to mitigate and prevent, and even in some cases reverse chronic conditions like diabetes or prediabetes, for example. So I think there's more confidence in recommending healthy strategies for prevention. And the area of nutrition and exercise is so complex. Right? Every time I read an article, I have more questions. So that's always the challenge, is interpreting that science and that data into something that actually is going to be actionable to the person who's sitting right in front of me. And so I think that there is definitely schools that are societies that are trying to make that information more tangible, more practical. I think that's important, because even though we know what the mechanism is or what the pathways are, yes, that's very important to do the study and research, but ultimately it's the person in front of me who has to take that on board and put it into practice. So if, as physicians, we're given more education on how to relay that data, or if there was already a good credible area where doctors can get that information, and also be able to learn how to coach, because that's some skill which I think is missing. We're taught how to break bad news. We're taught how to give bad news. And, maybe some schools also have a bit of behavioral therapy training on how to smoke and how to stop smoking or cut down alcohol. But I think beyond that, there's also a larger perspective. How do we make these changes more easy for people to do? And I understand that there's also that socioeconomic determinant of health, where not everybody has equal resources, but it's about finding out, what resources this person has so that they can make those changes. I think that's a very critical skill, because yes, doctors used to be the go-to person, where if you didn't have the information, you don't know what the diagnosis is, you have to go to someone. And to some extent, you still need to do that. But a lot of people can Google information now. They can really access that information themselves. So what does this physician do? Well, we have experience. We utilize that experience to actually help put the symptoms and the condition into context. I think that's where our unique skill set is, because we know how the body works, what's the priority of it, what does it look like when it's in healthy physiology, what does it look like when it's not healthy physiology, when do we actually have to institute medical therapies to get that person back into a healthier or more optimal state. I think that's something which, as a clinician, we really have a unique opportunity to learn, because medical school is great. I always say I'm so glad that not only did I learn the basic sciences, but I learned how to put them into practice, how to come up with a hypothesis, how to then, if the hypothesis wasn't the case, or if this was not the condition, how do I go back and review that information and then reassess and reevaluate and change my mind? I think that skill, that critical reasoning, is something that medical school is very good at teaching. So I definitely think that there's a role to play to continue doing that really well. But now to shift that focus into how do we prioritize what people need to do to stay healthy? So I think that's very critical. And I think sometimes that message is very confusing, even amongst the colleges for nutrition that I go to. There's a lot of mixed messages. And I think it's important that we have some better consensus. That's the reason why I'm part of the Healthy Longevity Medicine Society, because we're trying to look at what keeps people healthy, and we respect the individual differences. And research is actually growing in this area, so we're starting to know more. Now the question is, how do we take the research into practice? What tests should we do? What biomarkers should we be looking at? What should people prioritize? And so I think this is a really exciting time to be working with other physicians who I found along the way who are also of the same mindset. So I don't feel so much alone.
No, that's really awesome. And I think, as you said, it's a very new field, not long time ago, I guess. And for me, it's kind of important that you find a community that is willing to make these changes and offer a guidance, right? Because medical professionals always have to have like a guideline to follow. And I think due to, and we come to this later, misinformation and so on, it's for you a bit more difficult to actually convince people, because many people out there misinterpret any study, or don't know what is the reason behind what is the strength of a study, or what's the weakness. And I think it's wonderful what you're doing. It's really amazing. So I'm so happy that I have you here, and that you can spread the word about it. One thing that I might want to add is, since you're already on the critical thinking side, so you're not someone who is shouting out every study and be like, this is the way we should go. Why didn't you go the route of, for instance, being a clinician scientist? So you could do the research and still be the doctor.
I guess it's... I guess in my own way, I found what excites me. I guess I utilize the opportunities that I have, and I'm very grateful actually for those opportunities. I did, I don't actually go into the lab. I'm not sort of doing those experiments, but I do love and respect the scientists who do. And I think that if that opportunity is presented to me, yes, definitely. Why not? At the same time, I also love seeing patients. I love the interaction. I love the way that I can put information out there. I think that's also a skill set which I feel very passionate about and have developed over time. So, and when I'm doing sort of the speaking in the workshops, I realize that it's something that really energizes me. So I've chosen to develop that a bit more, so that I can help spread good news when there is good news, and then also help change people's mindsets about their health. So I think, I don't know if you can actually do both well. That's a really good question. I'm not sure. Maybe.
It's a really balanced act. We have a clinician scientist right now in our group, and he's a pediatrician and specialized in nephrology. But even for him, it's not easy. So it's not balanced and many pressure, of course, to deliver on both sides, on the medical but also on the scientific side. So I have huge respect. But I think I could imagine you being later on involved in any studies, because if you're really advancing the science behind longevity and health in general, I think it just makes sense to be also involved in human randomized control trials and so on, right?
That's right. Yeah. And I always have like lots of different brilliant ideas and studies. And I would love to like sit down one day and, say, look, I want to study about this. How do we go about doing this? So definitely my colleague, actually also, she's a psychiatrist, and she goes, oh, you could do a study on this one. So yes, that's true.
So maybe we will read soon a study from you then. So stay tuned. But I would love to actually maybe we can help somehow, like scientists and medical professionals should work together to advance the knowledge about this. Then I would come to an end to this very first segment. So we talked about your background and how you actually came to be a doctor, which is a no-brainer for you because you were already surrounded by it. And we also talked about a bit, in general, what kind of changes or differences you have observed. We talked a bit about also the pressure on medical professionals, but also, what kind of changes you went and why you were so passionate about doing health and longevity more. And now I would like to come to the section that is called From MD to Content Creator. So Laurena is not only a medical professional, she's also doing content creation on social media and YouTube. And you have been doing this for a while now, but when did you actually start it, and what was the point where you said, I need to do it now?
So I was encouraged by my personal trainer, actually.
True, she's also doing a really awesome content and showing what kind of weights she can lift and so on. So that's also really, really cool.
So excuse me. So I'm not someone who likes to be in front of the camera. In fact, I'm very camera shy. I don't like public speaking. It's not natural to me at all. But I realized that, if I were to inspire people, and if I were to try to reach more people, and social media had become such a huge, I didn't even have a Facebook account for many years because I just didn't want to be on social media. I'm a very private person.
Yeah, me too. Me too.
I love my own privacy.
Yes, yes. I don't need to share all my breakfast and dinner and whatever I'm doing.
Yeah. Actually, I don't. Yeah, it's not something that's natural to me. But I realized that when you're role modeling healthy habits and healthy behaviors, and also as a medical professional, I guess to some extent you have that credibility. People want to listen to you. So my trainer said, hey, you need to get on social media and show people what you do for your training and how do you develop these healthy habits. And I looked at him and I thought he was completely crazy because why would anyone care about what I ate for breakfast, lunch, or dinner, how I trained? And I think it was because it was not usual for doctors to, lift heavy weights or be in powerlifting competitions or represent Hong Kong for Muay Thai fitness championships. So I thought, okay, well, if I could inspire someone. And so really the intention was, if that video inspired somebody, I felt that I had made a difference already. And it didn't have to be the fact that I was a doctor at all. I mean, it helped, but I think it was to put things out there to help people show them that, it can be done. It might take a long time, but that's okay. And you might even fail. I've got failures of, not being able to lift something, which I always show and say, look, this is a process. And I wanted them to, I suppose, show a part of my life that was inspiring. So I kind of started doing a few videos and content and I was also fortunate because apart from being a medical doctor, I also taught group fitness. Mm-hmm. So group fitness classes, and that kind of got me up in front of a crowd of like 20, 30 people. And I had to instruct them on moving in the same direction so they don't run into each other. Okay. And at the same time, it was to music. So I had to listen to the music, remember the choreography, and instruct a group of 20, 30 people.
But is it more for make them exercise, or is it more like fun, or
make them exercise? Literally, okay. Make them suffer, but in a
elderly
fun way.
People, or also younger, or mixed population.
All age groups, all fitness groups.
Okay.
Yeah.
Yeah. Then of course it makes a lot of fun.
So I built confidence in setting up in a group of people where the attention was just all focused on me. And then I thought, well, I could probably utilize that skill and get in front of the camera and just be myself. So I slowly started doing videos, and then I slowly started I got my Facebook account. And at first it was just to see and keep in touch with friends and family and see what people were doing there. And so I started looking at the content. I thought about, okay, what would inspire me? How could I make my content better, more relevant to people? So I started learning from different doctors and scientists and how they would present information. And so I got a few tips here and there. And I guess in some way you develop your own style. So I would get more videos out there, more content out there. And then patients started following me, and then they would come back to see me, and they said, "Oh, I feel like I see you all the time because you're on social media," which is, and they were really positive. They're like, "This is so great, that you're, putting this on social media so I can share it with people, but also as a reminder of some of the things that." Some of the positive things as well. So I really do it because I wanted to be a part of that positive message.
Wonderful. Because I see that we need these positive, positive people out there who are actually expressing themselves and be like, I want to motivate you to have a healthier life. Which is also a motto from another doctor, a German one. He calls himself the German Dr. Mike, Doc Felix. He's also a really enthusiastic person, but also other people like Caro Baumgartner or Timo Osterhaus. Mm-hmm. Many professionals are now going in that direction to make this change, and that can only happen if you expose yourself a bit more to the public, even though it's very, very challenging sometimes for yourself because you're such an introvert. I can totally feel you, Laurena. But on the content side, so of course you have a lot to say, but I was also asking myself, is it sometimes really difficult for you to come up with content? Because for me, as a scientific content creator, it's sometimes really weird. I want to talk about a topic, but then I'm like, oh my God, I don't have the information, and I get into a spiral, and then in the end it's like a 40-minute video, and then I'm like, oh my God. So how do you deal with that? So do you have problems creating content or difficulties? And how do you actually come up maybe with content?
Yeah, so I have to admit that it was very, very random in the beginning because I honestly didn't know. I just kind of thought, okay, what would people want to listen to? And so I would just go off and just create my own content. And then over time, I realized that actually, there's a lot of commonalities in my patients, the kind of questions that they ask. And because it's such a common sort of lack of awareness, I wanted to create content specifically to address that. So then I started being inspired by the questions my patients were asking and from the common things that they were curious about or they were confused about. So it was to clarify those things. And at first, I think as a scientist, doctor, you always have so much in your head that you want to put out there. And I slowly realized that long content kind of might lose people. So then I started thinking, how do I make this content easier to digest in bite-sized form? So I started practicing saying different things in different ways to different people. And if I had people with their eyes glazed over, then I would know that that's probably too long and too complicated. I need to simplify it. Or if I use a different metaphor or an example and someone go, oh, yeah, I get it, then I would say, oh, well, this works. So I need to create more content in this way and you use this method. So over time, I've become a little bit more, hopefully not quite, but a little bit more systematic. So I always find, I actually don't find, I don't have a problem of not finding topics to talk about. In fact, there's so much to talk about. I don't even know what to choose sometimes because the way a message comes across might resonate differently to one person versus another. And that's something which I learned when I actually had to prepare for my TEDx talk. So
yeah,
I had
which is also cool, right? So you were invited on this big stage to talk.
Yeah, so that was a different challenge, something which again I was totally unexpected, but I was invited, and I realized that yes, I do have something to say and something I'm very passionate about to say, and it was actually the topic of sarcopenia and how in menopause we start losing muscle at accelerated age and how that affects quality of life. And so this was a 6 months process in making this 12-minute video. So there's a lot of people going voluntarily in supporting me through this process and all the other speakers. Anyway, so I realized that not only do I need to give factual evidence-based data, but I also needed to make that data connect with different people, because it might not just be a menopausal woman. It could be a young woman. It could be a teenager. It could be an older woman. So how do I make that data more relevant to each of these groups of people? So I would have to imagine my audience and imagine sort of a persona in front of me and provide that data. So I always find content, but sometimes it's put in a different way because it will reach different types of people. And I think that's the great thing about social media, is that anyone can be there. And then, of course, anyone can say anything. But again, you can also put things in a way that makes sense to this population or this population, and you can tailor that. So I think it's actually very exciting. I don't think I'll ever run out of content. I even said to my friends, I could be doing this until the day I die because my brain would still work. So I would have to find creative ways of, connecting with people.
Really awesome. For me, because I know, so I also have the same. I could do a content so many times, but I think the time factor is a bit that is limiting. So you have to sit down, you have to make the posts, you have to make the videos, you have to edit it. But one thing that I would like to know from you is, of course, besides your patients giving you positive feedback, what was the most beautiful moment you had during that time or doing now as a content creator on social media? And are there also downsides besides, of course, having extra shifts to make the post ready and so on? And what do your fellows actually think? And is it hard for you to build up your community with the followers? Because sometimes I read that followers are not very reflective of the content creator's influence.
Yeah, so I agree with that. I think I don't necessarily think that the number of followers reflects how accurate your information is or how you connect with people. That's, I guess based on an algorithm. And also, by the way, you can purchase followers. It doesn't really make any sense. They're not really engaging. And for me, creating that content isn't really about the followers. It's about the quality of people who, read your content. They like the way that you say something. They help you. Sometimes they reach out and say, yeah, when I read this, it really helped me. I understand this a bit better now. And even just people reaching out to say, I would like to come and see you. Because what you put out there really resonates with me, and this is the approach that I would like to take. So actually, I don't think that having tens of hundreds of thousands of followers necessarily gives you that. In fact, I think sometimes that can work in a negative way, because you can end up living in a world that's not very real. So I do this post and ghost practice, where I post something and then I just leave it. Because I don't want to be obsessed about being on the phone all the time. I mean, it's a tool, and I realize it's just one tool out of so many different ways of reaching people. So I suppose I try and have a healthy relationship with it, and I understand that not everything that you read, even on social media, is relevant. So I also personally like to follow people who state the references and who actually talk about things in a balanced way. And I think there are ways to identify, when you're looking at people's information. So I think those people also inspire me. In terms of other practitioners and physicians, I think most of them who are on social media are very positive, because I think they realize how much work it does take to actually do your own, put your own information there. And I think there's a healthy sort of support for each other. So I think most doctors who are on social media are positive. Those who aren't, they're probably not really aware anyway, to make much comment. But yeah, so I haven't really had any too many negative things. And
Okay.
I think also, yeah.
That's really cool, because I just heard a story. Of course, I have met this medical professional in front. So I just heard from one post he made that when he started with social media, that the elderly medical professionals were really against it. They didn't like it, and they also kicked him out in the end. And some other medical professionals were laughing at him and be like, what you're doing, that doesn't make sense. You should be in the hospital. So of course it could be now something, since you're in the Asian region, that there it's more acceptable rather than in the Western. I have no idea. But I guess that was something that was now in Germany. So I can only speak for that. I don't know how is it in the US. But that really is, for me, amazing to hear that you have nearly only positive feedback, because this is actually how it should be, that you have peers or fellows who actually support you and say, that's really great what you're doing, because that's an extra time that you're investing. So having that in addition is also sometimes really energy consuming, right? So I think it's wonderful that you have so positive feedback. Just quickly on making in bite sizes. So the effect of watering it down, right? How do you deal with that? And when is the point reached where you say, okay, there I watered too much down?
Yeah, I think that's always an ongoing review and reflection, right? Because there's so much information and nuance to everything. It's hard to say every detail. So it's almost like I start with what is the amount of information I want to give, and then I think, okay, what are people going to really need to take action? So I guess I look at what is my goal for this post, and how do I give enough information? It's kind of like an informed consent, you thought, because when you do a particular procedure, for example, when I do aesthetic procedures and I'm about to inject someone's face with toxins and fillers, what is it that I'm going to tell them about? I can't say the whole list of 100 different potential contraindications. But if I know my audience, I know what they're most fearful about, then I can tailor the consent so that I discuss all the serious things that are important that as a medical doctor I need to discuss. So blindness, vascular compromise, stroke, all those serious things. And then I also discuss the things that the patient themselves is concerned about. So I think it's important when we are putting information there that's concise, but not completely out of context. So I think there's a bit of a skill in doing that. And I'm not saying that I'm perfect. In fact, I could probably do better. And so it's a bit of a learning process, I think, for all of us. And I guess that's also gives, I think also if there is an opportunity to, if there's an opportunity to answer, like sometimes patients will ask, oh, I'm not really sure about that. I think if there's an opportunity to answer those questions, I think that's also helpful to get feedback to say, I would like to know a bit more about that because I was a bit confused. So I think taking feedback is helpful. So yeah, so I don't know if that's helpful.
I have to say, Laurena, I'm really happy that you're so reflective on it and you want to give out the most proper information by not going too much into details, but also not making it so general that people might mislead it for something else. So I'm really happy that we actually met on social media and on Instagram. It's really amazing because I always learn something new, and I hope you learn also something new from my content, because I also had the urge to, because the content that I upload is sometimes only accessible for scientific people, but not for medical people. And I think if I can make a difference in educating also the medical professionals about latest scientific advancements, that might help actually, first of all, understand what is happening in science. So what is the latest knowledge that we have, but also what might be new in terms of what kind of biomarkers and so on. So that also helps in the end you and your peers actually to do more preventive care, right? And that I think is really beautiful. One thing that I would also like to know is what are the most important topics, besides, of course, preventive care in general, that you want to talk about and why on social media? And are there also topics which are really exciting for you, but no one is really interested?
Yeah, I actually, one of my other passions is about women in the workplace, women in careers, just women in society. And every opportunity I get, I try to learn more about some of the barriers and challenges that we can do something and take action on. So anything where I get invited to speak, I always try to look at, who are the audience? How can I help them? I think, it probably came from realizing that there's a lot of data on women's health that's missing, that there's a bit of a gap. And also being sort of in the medical profession, seeing my mom as a doctor and how she had to really, she really had to prioritize, she really prioritized herself last, actually. And I think many women do that. And I think sometimes the system hasn't really kind of caught up with the fact that women can have careers and they can work full time and they're just as, they perform just as well. But they do have the added, I suppose, intrinsic responsibility of having to care for your family and their children.
Yeah.
So that's something I'm really passionate about, and people don't really know. And maybe they're not interested because they're not aware that there is a gap. And so it kind of all ties in actually with the topics and about menopause that I talk about is, why is it that we have so much confusion and misinformation around it? Well, it's because we were not educated about that. We didn't actually we didn't actually, even from school, we didn't sort of talk about the entire reproductive spectrum. Yeah. So how do we then address that later on?
Yeah. Completely agree, Laurena, completely agree. I'm really happy that you're also having this site and taking young women with you and supporting them in their time. Of course, when you're on social media, it's nice to be influencing people's life, but at least for me, it has also been kind of stressful. So how do you actually cope with general stress and specifically social media stresses? Because I think social media is, again, something very special when it comes to stress and how can I say that? The psychology effect, know, that it has. Yep. And maybe if you can give an advice to the audience or the creators out there who are also doing this.
So firstly, I think coping with stress, we all have stress. I don't think we can sort of not have stress. I think stress isn't necessarily a bad thing. In fitness, we talk about muscle stress and cardiorespiratory stress because it helps us adapt. Yeah. So we get better at it. So I think it's the actual length of stress and whether or not you can completely recover from it. And that actually means having a support system. That's, to me, what resilience is that under stress, you have enough buffer so you're able to cope with that period of stress until it either goes away or you change your mind or you change your perception about it. So being grateful that I have an opportunity every single day to make a difference to anyone, whether it's on social media or in person or even outside of the clinic. Doesn't have to be medical, just be a kind human being. And so I think when I look at, today the weather's so bad, I don't like today, but then I realize, well, actually I have a roof over my head. I mean, these simple things that, some people in those countries don't even know where they're going to live or have food on the table. Maybe it's because I live in Asia, so we do see quite a stark contrast in people who are homeless and don't even know where the next meal is coming from. So I think it's being a part of that reality and seeing that regularly that makes me grateful just to be here. So I think gratitude is definitely something that myself and my husband practice each day. So we always regularly ask each other, what are you grateful for this week or today or last month? And just reflect on that. So I think having those conversations and surrounding yourself with people who are also bringing that positive energy. And then learning to say no to the things that you don't resonate with or, you don't want to be around. And it's okay. It's okay to say no. I think sometimes as health providers, we always are pressured to say yes. But actually, one of the skills is in learning to say no politely. It's called the refusal sandwich that I give to people.
I didn't know that this term existed. Now I know it. Cool. Next time I use it. Sounds delicious.
Yes. So in general stress, I think that's how I cope with it. In social media, I think sometimes it's a bit different because for me, when I see information that's not accurate or when someone says something really outrageous, that stresses me. It frustrates me rather than stresses me, I guess, because so many people are listening to that and now they're going to think, oh, this is the truth. And they don't know any better and they follow this diet. And I guess my frustration comes from when I see a patient and they come in and say, oh, this is the best thing that I should do. I should just eat bananas for the whole month and lose weight. Then I had to spend another 15 minutes trying to undo that misinformation so that we can move forward from there.
Yeah, I totally get you. This misinformation stuff is really, really bad. And thanks a lot for giving some advices how we can actually cope with stress a bit better. Of course, there's a good stress, but there's always the negative impact that has psychological, but also physiological effects. And very importantly, I think, is also from my perspective on how to deal it, especially with social media. Since I did not consume it very much, I'm maybe a bit more resistant to it. So if I see something that is not okay, I just skip it. So I don't look at it or try to comment on it. I know that some fellows are really eager to debunk everything, but I guess for me it's not the way to go to call out this person. And since I'm also a small content creator now, it kind of could bring you to a point where you don't want to be on social media anymore because you get so much hate. So I'd rather take the topic and try to make the better content out of it and educate the people and telling them what might have been discussed wrong. I think Dr. Lane Norton is really well in doing these kind of stuff, in calling out all these influencers who are thinking by reading one page of a biochemistry book they know everything, right? So, and I think it makes for us as who are passionate about giving proper medical and scientific information even harder, because there was one quote, he said that if you're an expert will never be 100% sure. Right? There will always nuances. Yep. They will always ask questions back so they can give you in the context the right answer. And I think, I guess this advice I can give to my audience as well, and in general, that you should look for people who are balanced and say, at some point, I don't know. Right? So I think that's also really important as a medical professional, I guess, as well, that if you have a topic that you're not 100% sure, or the science behind it is so contradictory, either you don't tell anything about it, or you are very pronounced in telling people what is the nuances to take care of, and that not every diet and every pill that you take or supplement is gonna heal you or is gonna make you 100 years plus. I think the critical thinking should be more in the people, so they should be more critical.
Yeah, I think that's always a challenge, because I realize that not everybody has had the opportunity to learn how to critically reason or appraise content. And I was fortunate to have gone to a medical school that really took their time to teach us as medical students how to appraise a scientific article. So I was very grateful, even though at the time I didn't understand why did I need to learn this information. But now I realize particularly in nutritional medicine, where there are so many different nuances and so many different biases, and I think understanding the hierarchy of that information does help when I'm trying to look for answers. And I think sometimes it's also maybe part of professional upbringing or culture where you can't admit to not knowing. There's a bit of that, I think, sometimes in the community. So I think we kind of need to ourselves just be okay with it and accept that, we're not going to know everything. Sometimes we just don't have ways of measuring it. But until we do, then this is the best practice. So I think we also need to just have transparency and just say, look, we haven't researched it. It's not there. This is what we have. This is as much as we know. And I think people appreciate that honesty. If you say it that way, at least they can understand why there is so much confusion. And And yeah, you're right in the sense that I don't really get into debates. Like sometimes people say, "Oh, you should comment on this," and I said, "No, I don't really need to debate about that point because that's not really the platform to talk about those things. So I'd rather put my energy into actually creating more accurate information for people. And I think that's better use of my time. So yeah, like yourself, I think it can be very easy to kind of get into that emotional aspect of social media, but have the ability to stop, pause, and reflect on, is this good time? Is this good energy? Is this good way of using that time?
Completely agree. Wonderful statement. I think we end or wrap up this second part. We were talking about how you started doing content creation on social media and how passionate you are about this because you want to educate the people. But we also talked about a bit how difficult it is and also how to come up with content and how we deal actually with the watering down effect, which was really eye-opening for me. And the next part is kind of actually in addition to it, because I want to highlight more to fight against the misinformation on social media. So in my opinion, medical science and science in general or the content are not that far apart, but in the end we work to understand, of course, the human body, but we both, of course, have different resources on how to stay updated. So my question to you would be, how do you actually stay up to date with the literature? And if you do your own research, how is this actually different to what I'm doing maybe? And should scientific professionals like me reach out more to you, medical professionals, to actually educate each other on specific topics? So what's your take on that?
So I am very grateful. I actually have an opportunity to search any kind of article in full text that I want, because I think that's a lot of that. Sometimes they're behind paywalls, or you can only sort of access it if you pay for an article. So I have that opportunity to be able to access that because of my contribution to the Hong Kong University. So I'm very grateful to them to allow me that. So I love reading journal articles. I think that's probably very odd for a lot of people who think that, reading maybe sort of a self-help book or, something else is probably their entertainment. But I'm always very curious. I've always had this curiosity to try to get as close to the truth as possible. I know that it's not always possible to get the absolute truth, but I always want to get as close as possible. So I find myself sometimes going down rabbit holes to try to look for the answer. If I can't find it in sort of places which I sometimes go to, which for medical doctors, it would be your local medical journal, or it could be apps nowadays where you actually have the best practice information, so that you can look up a condition, look up what's the best practice, and then they will always have a reference for you to actually look up there if you really are interested in it and wanted to get sort of more into the actual details of the study. Because it allows me to understand the topic better. And that's really my passion and purpose, because if I understand the topic better, then I can understand how to apply it and how to explain it to my patients and how to help them be comfortable with the decision that they're going to make. Because a lot of what I do is, again, based on having not perfect information, but close enough information. So this is, I suppose, how I do my research. So that's different to what you do in a lab, where you have to control for everything, because you're really trying to look, does this particular intervention or does this particular pathway actually show this outcome? So we need that information. It's very critical for us to understand the mechanisms of why something works, because sometimes we observe that, okay, this behavior works, or this food works, or this nutrient works, but why? We don't always understand that. But if we can understand it and we can harness that better understanding to develop something that's easier for us to make people better, then why not? So I think that there definitely is a really important pathway where physicians see an observation, because that's where things start, right? Like you observe something, you see something change, and then you kind of assume that that's why it changed, but you don't really know exactly if that's the cause. So we kind of need to get deeper down into what that is, and that's where research comes in. So I'm so grateful that we have tons of research. Yeah.
Just from so wonderful, first of all, really amazing. But you don't have a team, so you do really sit down and read everything on your own, or?
Yes.
Okay.
I don't have a team.
So even more,
My team
a
is
big support for her. Please follow her. She's doing a great job. But from my medical, from my scientific standpoint, yes, I do read, of course, the specific articles that are in my field. In my case, I'm a bit lucky because I'm working in proteomics, which means I'm working or looking at the proteins within your cell and what is changing. But I realized that if I want to expand my horizon, I need to read also other research articles, not only about the specific topic. I love to have it in a more medical way. So I always read from other disciplines and try to understand what is happening. And that's why I'm actually a huge fan of working with medical professionals together, because so the called biomedicine research, I would call it now, because I think if you have the power of both disciplines, then you can make a huge impact. That's what I think. Maybe you can comment quickly on this, what your take on this is.
Yeah, I definitely agree, because the impact of what you study is so far-reaching that it could reach a lot across a lot of different disciplines. And yes, we have to separate clinical practice into different disciplines because that's how we kind of specialize into an area. But at the same time, we also need to communicate with each other regardless, because a person's health isn't just their organ, they're a whole person. So when we understand pathways, I think one of the beauties and one of the things about what I love about science is that science has a system, and it's very clever, it's very efficient. It will make certain enzymes do multiple things. I mean, so when you study one particular area like proteomics, it goes across so many disciplines.
Yeah.
Like, what is the need in that particular discipline? Is it under researched? Do we need more data? How can this area be helpful in expanding the knowledge so that we can come up with interventions and therapies? And we won't know that until you talk to somebody outside of that who's actually practicing it and seeing these conditions and diseases pop up. So I think it's wonderful that we have this conversation, that we don't just work in our own silos. And I would love to say that for, chronic disease and like all the other disciplines in medicine as well, that, ideally we should have a team all under one roof and all talking to each other and have a system of, contributing to a patient, because a patient isn't just, it's not just the sum of its parts, more than that.
Yeah, totally agree. And I love actually, so this is a bit more coming now into Germany as well, but I guess in the US it's already a big part, the so-called bench to bedside and back, which means that there are research institutions that primarily focus on medical science and actually take the patient and bring it to the lab bench, and then we analyze what is going on, and then refer it back maybe to even a therapy, which is mind-blowing for me. And I would love, so I have a vision that one day we have, for instance, an institute that is directly coupled to the clinic, and that we have like a sidewalk where scientists and medical professionals are really excited to talk about what is happening, and that in general scientists can make their contribution to the society, and of course the medical professionals to treat their patients, of course, better, but also taking back to preventive medicine, that we maybe also start to look at markers that maybe are for health and longevity, that can help to figure out if a certain person is already going into the disease state but doesn't have necessarily something going on. So he or she is feeling well, but the blood markers don't look really that amazing. And then, that there it starts to intervene and find. I think that would be amazing. Let's see if
that'd be truly exciting. Yes.
And I can already imagine walking by, passing you, and we both are like, yes, we did it. That would be awesome. Of course, we already talked about one of your main topics is also menopause. And I was when I was looking at your posts, and I really liked the diversity of the posts. But one thing that just got stuck was that even 31% of female doctors experience menopause symptoms, and they have to reduce their hours or even have to resign. And we talked quickly about that menopause itself, or the general science behind it is not really well established, but I would like to have your take on it. Why do you think it's so poorly studied?
Actually, I don't necessarily think it's poorly studied. I think it's actually poorly translated into awareness. So I put this post out because I personally was going through this phase of perimenopause, so the 5 to 7 years before the official time of menopause.
Can you quickly say what kind of symptoms?
Yeah. So I was getting hot flashes, I was getting sleep disturbances, and I was getting a return of migraines with aura, which I hadn't had for more than 10 years. And so I didn't actually put it together for myself, because I was still having regular cycles, and that was something which really caught me off guard, and also catches a lot of women off guard as well. So that's when I realized I was so tired, to the point where I was someone who exercised 6 days a week intensively. And I was floored. I could barely do one exercise session a week because I was so fatigued and so tired. Then I realized that as I was going to work, I was getting migraines while I was seeing patients. And that sort of, slowly occurred over a period of 2 or 3 years. And I didn't realize that this was, and I thought, to myself, oh, I'm just aging. Maybe I need to retire early or cut my hours down. And then I started looking around and realized, actually, I'm not the only person, that there were studies that were published. I think this particular one I referenced was from a research in the UK of female doctors and how they reported and surveyed their experience. And I realized that actually it was in the medical profession, and we're supposed to care for other people. And so how can we, as we're going through this important stage in life, deal with that? So that's why I put this post out there, because I think it's something which people don't really realize. And when they go and see their doctor, they might not realize that their own doctor's going through this. And, menopause is not something that's, whether or not you have symptoms, it's not a personal failure. It's a biological reason. There's a reason why we're selected to live so many years past menopause. It's a special genetic human gift that we give back to our grandchildren, and, teach the younger generation. So, but we do struggle, and some women do struggle regardless. And I would tell myself, if you picked anybody who were not going to have symptoms because their lifestyle was great, I would pick me. But yet it had nothing to do with me not following a good lifestyle. But following a good lifestyle actually alerted me to the fact that these symptoms were not just part of aging, that they were something else. So I think what's not well communicated, and again, I think this is also because maybe in the system, we think about reproduction, we think about fertility, we talk a lot about that. But then maybe it's also society, and maybe it's also the perception of women getting older, that there's this fear. And I think this fear is generated by lots of different influences, outside of just the biology, there's also this cultural taboo about getting older, and looking older and feeling older. And even today, like even this week, I had women come to me and say, I fear getting older. I really fear this. And I thought, wow, like, I thought, the fact that we are living longer and our life expectancy is longer, it's great news. But yeah, I mean, I see people say, oh, I just accept aging. I'm just going to age. So I'm just going to let myself go and not bother.
Yeah.
So I see all these kind of sad perspectives. And it's just that we haven't really kind of messaged on, the positive things that we can actually do. And there's tons of information out there that we can still do. That can help us age with good quality of life. Because ultimately, when I ask patients, how is it that they want to age? It's not the length of the age. It's more like what they can do. It's the quality. So I think it's just that we don't really have a very positive way of messaging it. There's just so much fear. And, menopause is a very specific transition. And we should change the dialogue and change our mindsets about it. And I guess it came from the fears of hormone therapy. But again, hormone therapy is just one aspect of managing menopause, right? There's also that parallel aspect of age-related aspects. There's also things like, career aspects. And a lot of these things also occur and co-occur at the same time. So women don't really have a place to go. So they're a bit lost. And I think when they're lost, they start searching for information out there. And I think when that happens, there's also this, prime time of, I suppose, monetizing this fear. So I think that's probably why it's poorly understood. And I feel that as a medical society, I think we are trying to do a lot of work to try to get that message across. And so it will take time, but it is there, and I'm looking at it and I'm part of it. And so I feel very positive that, our future generation will have a much better exposure to it so that they will go through that transition better. So I'm hopeful. It's just that, now as women my age are going through that, we have a voice now. Yeah. So I think we can positively utilize that voice. And that's also what I'm trying to do as well.
Yeah, I totally agree. Regarding the point of working, I just saw a documentation and it was a bit more about Germany, but they were saying that it's still a stigma and how can I say that in a friendly way, that women going through menopause, they should not be whining around and just do their job, to say it in a nice way. But in the end, the body is going through such a big change, and telling, and unfortunately these are male people who are telling that to tell a person or a female, just do your job and come on, it's not that of a big deal, is something that we should maybe start to rephrase and take all these symptoms also really serious. And because that person who was talking, she could not work full time anymore. She had to even cut down her hours, and I think she even changed her job because the new in the new job she could cut down on her time and even leave when she was really not feeling well. I think on the workplace we also have to think about these people so they can still do their full-time job, but we have to offer them possibilities and hear their problems, right? I think it's a big problem that we have to solve.
There's definitely a lot of need to educate in the workplace. I think both men and women, because sometimes women themselves don't even know that they're actually going through this, because there isn't any other opportunity to explore what menopause is. So I think women themselves are not aware. And so I think there's a lot of things that we can do in the workplace for better awareness and education. And I think, it's not that women can't perform or do their work, but they do find it more difficult. So it may limit their career choice because they choose that they will just work less hours to be able to cope with the symptoms. But I think if we put it as part of overall health and well-being, that means that we're able to make some small adjustments to either their schedule. I mean, every workplace is different, so there's no one size fits all that's right for every workplace. But I think having someone who is understanding of the symptoms, and it doesn't even have to be very specific, it could just be menopause symptoms, and finding ways where, they can have a fan, or they can wear uniforms that's layered, or they can have sort of a designated room where they're getting a hot flash and they need to just sit for a couple of moments and just get over the hot flash. I mean, they're and then there are medical therapies which people are still really completely unaware of, and even doctors are not necessarily aware of. They're actually safe to provide. So we have a lot of work to do in terms of medical education and training, so that providers are aware of what is available and what are the indications and how to counsel women about their options. And then also in the workplace, be able to help them navigate that too. So, yeah, definitely lots to do there, but I think it's positive.
Wonderful. So we did our first, telling the people the information about what you can do actually, right? And that we motivate actually also medical professionals to look more into it and tell people what kind of different therapies are out there. So my last question to this part would be, we already mentioned it briefly. Of course, there are other medical professionals on Instagram, TikTok, or YouTube doing also information spreading, I would say. But oftentimes it's spreading misinformation, because sometimes you have the feeling that these guys were not in the medical school. And I wanted to hear from you, is there a way how to cope with these fellow peers and also even warn the public about it? And how do you think can people find a reliable source, and what would be the key points in your opinion for a trustworthy MD?
Yeah, so I think this is really tricky because, people might say, oh, I'm a graduate, or I'm a professor, or I'm a PhD, and I'm a doctor. So, I think it's also partly educating the public on how to verify the information, because it's not just that, oh, I'm a doctor, so believe everything I say. I think it's also important that when you are looking at the pattern of information that they're giving, are they able to reference the information that they're saying? Where does it come from? And I always and I always do that myself, is to put the references there where they can then go and verify that this is accurate and correct. And they're also referencing other authority sources, because I think that's also important, that you have the backing of medical societies or consensus statements or guidelines for what you say. And I think it's also important to see whether the other information that they're saying has a bit of nuance to it. Because I don't think you can 100% say for certain that anything works 100% for everybody. We just know in general that most of this will work. But you also need to give that information in context.
Yeah.
So what is the context of this information that you're providing? Who was it originally studied in? And can you apply it into the outcome that you also want to apply? I think it's important to state those things as well. And yeah, I also think that if something sounds a bit too over the top, like too sensationalized, I'd be very careful about that, because I think one of the things, and this is a struggle, is to try get get people's attention. And, negative news always gets people's attention because fear is great to sell. So if something sounds too scary, you really kind of need to have a bit of skepticism, take a pause and go, is that really the case? Look a little bit deeper. I think everyone has to nowadays do that because anyone can be on social media and say whatever they want. And I think it's important to be alerted to that and not be emotionally drawn to it, because we do have confirmatory bias. And the more we look at the same information, the more we search for it, the more it's going to come up. So I always think it's a good idea to search for the alternative, to search for the opposite of that information and read that and evaluate, how, what does that opposite actually say? So I think as a consumer, as a user, it's critical to arm yourself with this knowledge and ability to deduce and filter information.
Yeah, I totally agree. And beautiful words to end this part of the conversation. So we talked about how Laurena and I actually fight misinformation on social media, and how she does actually her literature review and understand everything and try to educate people. We talked a bit about debunking a bit the misinformation, of course, on menopause, but also what can be done so the people understand more and be aware. And of course, what can we do when we have fellow peers that are BSing, unfortunately, and how you actually can cope with it. So I would like to come to my last part with you, Laurena, and that is medicine and science, two separate entities in one body. So that's my take on it now. I have the feeling that these two disciplines, so medicine and science, has become two separate entities in the same body, I would say. So when you look back in the ancient Greek time or in the Roman Empire time, we didn't have this separation. And you can, of course, correct me if I'm wrong, but what would you say? Is this correct? And how do you feel about it?
I think it's interesting because I like history and I like looking at the development of medicine and all the different fathers of medicine. And, some of them were actually philosophers.
Yes. Yeah.
So I think we started observing humans in nature. So we looked at the whole person. And then as we started to have ways of researching and trying to dissect more of the ways and mechanisms that things work, we start to separate things because it was easier to understand something if we actually just reduced it to very simplistic pathways to understand. And I think that's still important because we still need to understand how things work, because we could then explore and expand and build on that. But we can't forget why we're actually doing this. What is it that we're trying to solve? What's the answer that we're looking for? And ultimately, if we were to use that logic and that information to understand something better, how does that translate into a good outcome? So I always look at, so I always talk about reasoning information and how is that valid? So I always talk about pathway medicine. We're not just treating a pathway. We're trying to get an outcome because we're human beings. We have a quality of life. We want to prevent disease. So this is the process of the disease. And yes, maybe this treatment helps to reduce glucose, but in the long term, does it reduce death from diabetes? Right? Like ultimately, if we spend so much time and effort and energy into bringing down one marker, but it doesn't actually make any difference, then what's the point? We're wasting resources.
Yes.
So I think there's a very important, it's very important to understand that no one's better than anybody. We all serve a purpose.
Yes.
And both are really important. And I think we can help each other by just being more communicative and using a language that's common to us, and we have that common language. So we need to do more of it.
Yeah, I absolutely agree. So, in my opinion, also, we have the same language, but the problem is we are not communicating enough. And as you said, there's this bias or this thinking. I don't know how to phrase it, but one discipline is superior than the other, which is completely not true. And I think to harness the most benefit from both, I think we need to collaborate more, we need to talk more, and that's why I think both disciplines also need these crossovers also on social media. That's why I reached out to you, because I think it's a wonderful collaboration. We can talk about the same topic, but from different angles, which is always very important, right? And maybe can you say how can we ensure that both disciplines can work together and create the most effective content out there? And so in my opinion, I would love to make more videos with a medical professional by my side, and I read the research to it, and then we present a topic together, because unfortunately, and this I was not aware of, there are scientific personnels out there who are giving medical advices, which is for me a complete no-go. You don't have the education to do that. And I don't get why people, especially from the scientific field, think they have to give medical advices. So if, as an advice to the audience, if you hear someone who's actually a scientific expert, but gives you for some reason a medical advice, that's for me a huge red flag. I would never go out and do that. Yeah. I would always seek out, for instance, with you, Laurena, and ask you what's your opinion, and would always ask you. So what would you say?
So my pet is making an appearance. I think he has something to say.
Ah, very good. So welcome, welcome.
Yes. His name's Frosty.
Welcome, Frosty.
He wants to weigh in on this topic. I think there has to be a healthy respect, right? Like, I really respect people who spend so much time, like there's so much dedication and accuracy that's important when you're doing research, and so many things you have to consider, to exclude and to factor in, that I think it's a very difficult field, and it does take people to really focus on that. And so the type of people who are clinician scientists, I have no idea how to even go about doing that. But I think I think what's important is we also need to provide feedback on how, be transparent about how we make decisions as clinicians, because we know that there are outliers, that there are people who don't respond to treatment. And, we have to be able to also communicate, how do we make decisions? Because if it was in a controlled environment, it'd be simple. Everyone would be responding the same way. It would be very predictable. But the reality is we treat people who live in the natural environment with the challenges of adopting different treatments or taking a medication, or, you could have the best, most perfect solution, but if people don't use it, it doesn't work. I mean, the classic example is we know statins are very good for heart disease, but 50% of people don't take it. So
it's the same with vitamin D, right? It's the same with vitamin D. So
yeah. So we also have to have clinicians who practice it, because that's their area of trying to engage their patients and trying to help them develop, a way of prompting them. So everyone has their own skill set, and everyone has to develop their own skill set in a very specific way, which makes us, I suppose, experts of what we do. But, at the same time, we don't have to be everything for everyone. That's just not possible, right? I always joke around with people and say, look, I'm a GP. I'm a jack of all trades, master of none, but better than a master of one. So I actually love what I do because, I mean, I'm a master of doing a bit of everything, but I do a bit of everything because that's the type of people I deal with. They live in the real world.
Yeah, completely agree. And I think the part for science would be to dive deep more into these non-controllable environments, right? Because we always like to have it very sterile and very controlled, I would say. But in the end, we should maybe also think about the real life scenarios. I guess that's sometimes a bit lacking. And that's why the human randomized control trials are the non plus ultra, I would say. But in the end, of course, certain mechanisms you can only find out if you start, for instance, purifying recombinantly the protein and studying the interaction or getting the structure out and looking which drug might fit into the enzyme pocket, which might help in the end the people. Or very recently, a really cool trial in America actually wants to treat familial hypercholesterolemia. Yes, with this CRISPR-Cas thing, and I'm making a video about it. It's still in the making, but I posted it already. So that was really interesting for me because, of course, this is the genetic component to it, but it was really interesting to know that they already in the clinical trials saw some positive effects. So they could reduce to up to 50% the LDL levels. So you see, if you inform the medical professionals about these clinical trials, because not everyone is on the same page, I think, and then of course explaining also the biochemistry and molecular biology behind it, I think that makes a powerful couple, I would say.
I think it does. I think it's exciting to learn about these new developments and what's been going into trial.
Yes.
I think it makes the whole field very exciting to learn that. So I'm always curious about your podcast and the information and learning new things so that when I read it in the research paper, I understand it better and where it's coming from.
Thank you very much. So. I don't. Did you listen to the Alzheimer podcast?
Yes.
So that is one reason why I think it's important to go out and tell people, especially medical professionals, about this, because I could imagine that at some point this subtyping of Alzheimer's disease might be the key how to treat it in individuals, because all of them are responding differently. And I think that was a wonderful collaboration with my dear colleague Corinna, who is a neuroscientist, and I learned a lot and she learned a lot from my side. And even we scientists diverged, we are not all in the same field, and we also have this specialization, I would say. And then even we have to collaborate a bit more, which is sometimes not there. So I think that was a wonderful podcast, and I hope that you also took a lot from it there. I'm really happy that the podcast resonates with you. So it gives me the strength to continue, because, sometimes you are sitting there and be like, who cares actually? Only you. Imposter syndrome comes in and so on.
Yeah, but I think sometimes it's difficult to get feedback. So this is the reason why I think it's good to encourage each other and support each other through this process. But it's also very interesting to me because I think women are twice as likely to get dementia. And so when I'm in this space, a lot of women are fearful
we
about
had lab meeting. We had lab meeting. And a PhD student in our lab is working actually on Alzheimer in mice. And she was presenting the latest data on death causes. And for women, it was dementia, the most highest one. And really cool was that she found some trends already in mice. I don't want to go into it because it's confidential, but I was surprised about the death statistics. For men, it's more cardiovascular diseases, and for women, the highest one was dementia, and then afterwards it was already cardiovascular diseases, and it has to do a lot with the hormones. And some studies are already out, but of course, animal models cannot be transferred directly to human. Right, and studying human dementia is always a bit of an ethical thing. So you cannot, of course, take brain biopsies. That's not possible. Yes. But that's why I liked this paper, because it took the CSF actually, and they made a really good job in identifying some of the potential biomarkers maybe that we can maybe in some years already have as a little test. You never know, right? How quick the technique is advancing. And that also helps you because sometimes you have maybe patients who don't have a cognitive decline already, but they feel a bit weird, and then you can be like, okay, one of your markers is already up. So maybe to change something in the lifestyle might prevent already a bit or delay the onset of dementia, for instance.
Yep. So sometimes I think these markers are useful because even though they might not be 100% there, I think that if we have more data, we can actually help motivate and counsel patients on changing their behavior early on. So it's good to see what's in discovery.
Yeah, me too. So the last question then would be to you. What do you want to say to your audience and my audience in addition? And do you have any other topic you would like to talk about?
So I would just like to congratulate you on doing all this on social media. I think what you do is incredible, the amount of effort and time you put into making your videos fun and interesting. I love to watch them. So please keep going, and please keep sharing that information, because it takes people like you and myself who are not naturally extroverts, but still trying to balance out giving out credible information. So yeah, just keep doing that. It's wonderful to see. I'm so glad I found you and met you too.
Yeah, I'm also really happy, and I can just give it back to you. And maybe just out there, I would love to collaborate with you on some content, even doing a video together. That would be awesome. So I would really love to. Any other additional things before we end?
Nope. That's
it. Cool. So guys, we are actually at our end of our wonderful conversation with Laurena. Big applause again for her. Please imagine that now a big applause is coming. So Laurena, thanks a lot for your time. Now in Hong Kong, it's actually night, I guess. So thanks a lot that you had the time, and I'm sorry for the technical issues that we had. And I'm really honored and grateful for the efforts that you did, and that you come to my podcast and talked about this wonderful topics that we had. And dear listeners and people who are watching, I hope you learned a lot and enjoyed the great crossover with a medical professional. And for me, I learned a lot today. I learned a lot about Laurena, her medical career, what her medical content, in general, what is her passion, and what problems we all have to solve. And that was really, really eye-opening for me. And I would like to tell you guys, please follow her on Instagram. Her Instagram is @doc_Laurena. She also has a YouTube account, so please subscribe to her if you want to have more medical-based content and want to understand certain things. And very importantly, she is one of the medical professionals who are credible, so her information you can rely on. And of course, you can also connect with her on LinkedIn. And as I said, maybe we plan in future some collaborations. I would love to do And yeah, that's a wonderful time. I wish you all. I hope I see you soon. So I think I will schedule now maybe once a month to do a podcast. It's a bit difficult to get always the time to prepare, but also the guests. So I think that will be my follow-up now. And Laurena, you know I have a slogan. Do you want to tell the slogan?
Okay.
Let's
do it together.
Okay. Should we practice before or should we just do it now like this?
Let's just do it now.
Okay. 1,
All right.
2, 3. Let a little dose of honest science in your life. And brighten up your day. Cool. Let's do it once again.
Okay.
1, 2, 3. Let a little dose of honest science in your life. And brighten up your day. Cool. Awesome. Really awesome. Thank you so much. Yeah, guys, that's it. And we see us in the new podcast episode. And till then, have a wonderful time. If you have any questions, please reach out to Laurena. And yeah, we see us in the next episode. Bye.
Bye.